I'm Dr. Catherin Harris. If you clicked on this video because the title hit a nerve, take a breath. You're in the right place and you're not alone. Premature ejaculation is one of the most common concerns men whisper about in private and quietly Google at 2 a.m. Yet it's rarely explained in a way that's scientific, compassionate, and practical at the same time. Today I'm going to tell you what almost no one tells you: how ejaculation actually works in the body and brain, why it can happen sooner than you want, and what evidence-based strategies can shift the pattern. I'm not here to sell you magic tricks or quick hacks. I'm here to give you the science in plain English and a roadmap you can actually use. By the end of this video, you'll understand what's happening, and you'll have a structured, realistic way to improve it without shame and without superstition. Let's start with the simplest truth. Ejaculation is a reflex, not a moral test. Your body has a built-in sequence controlled by your nervous system. Think of it as a three-part cascade. First is desire and arousal, the mental and physical buildup that raises your heart rate, blood flow, and sensitivity. Second is emission. Deep inside, muscles in the reproductive tract begin moving semen toward the urethra. Third is expulsion, the rhythmic contractions that you notice at climax. Those end-stage contractions involve the pelvic floor and surrounding muscles. They're not consciously commanded in the moment. You can't will them to stop once the reflex has crossed a certain threshold, just like you can't decide not to sneeze when a sneeze is already exploding out of you. But here's the empowering part. You can change what happens before the threshold is crossed. You can change how quickly your body approaches the point of no return. That's where physiology, psychology, and skill all intersect. A second truth that calms a lot of anxiety. Rapid ejaculation is common. The average time from penetration to ejaculation in the general population is only a few minutes. It's not the marathon you might imagine from movies or memes. When clinicians talk about premature, we're looking for a pattern that persists, causes distress, and shows limited perceived control. There are two main forms. Lifelong premature ejaculation means it's been present since your earliest sexual experiences. Ejaculation usually happens very quickly with most partners and situations, often within about a minute of penetration. Acquired premature ejaculation shows up after a period of what felt like normal control. Ejaculation time shortens significantly and consistently, sometimes down to a few minutes or less, and the change is noticeable and frustrating. Both forms are valid, both deserve care, and both improve with the right approach. To understand why this happens, picture your nervous system as two collaborating conductors. The sympathetic system, which accelerates arousal and drives emission and expulsion, and the parasympathetic system, which supports relaxation, erection, and pacing. Over the top of that sits the brain's chemical messaging, especially serotonin and dopamine, modulating the speed of the reflex. Higher serotonin activity in particular circuits tends to delay ejaculation. Lower activity tends to speed it up. That's one big reason certain antidepressants, used off-label or on-label depending on the country, can slow ejaculation. They increase serotonin signaling. But chemistry isn't the whole story. Sensory input at the genital skin can be intense and vary from person to person. Pelvic floor tone can be high or low. Attention can lock onto sensation or leap to anxious thoughts. Your mind's appraisal, "I'm losing control," "I have to perform," "I must not fail," can spike adrenaline, which shortens the runway even more. If you add a history of rushing for fear of being interrupted, pornography routines that train a fast, high-intensity finish, or a new partner dynamic that magnifies performance focus, the threshold is reached even faster. It's not a character flaw. It's a learned, reinforced loop. There are also medical factors that matter. Erectile difficulties, when present, can make someone rush to climax before erection softens. In that case, treating the erection issue often improves ejaculation timing. Prostatitis or pelvic floor dysfunction can alter sensation and reflex timing. Thyroid problems, Certain medications or withdrawal from others can shift the pattern. This is why I always say, if premature ejaculation is new for you, worsening or paired with pain, urinary symptoms, or erectile changes, please talk with a clinician. A simple checkup can rule out treatable contributors and make your plan more targeted. A myth we need to retire is that premature ejaculation is solved by just thinking of something else or toughing it out. Detached distraction might buy you a few seconds, but it also disconnects you from pleasure and from your partner. It trains dissociation rather than control. The goal isn't to dull your experience. The goal is to ride the arousal wave skillfully. Another myth is that the problem is purely psychological and therefore all in your head. Mindset matters, but so do nerve pathways, pelvic muscle tone, hormonal states, and the ways you've trained your body over months or years. You deserve a plan that respects both biology and behavior. Let's build that plan. Think of it in 3 layers: knowledge, retraining, and tools. Knowledge means you understand your body's signals and know the point when continuing stimulation will tip you over the edge. Retraining means you deliberately repattern the system with progressive exposure. Instead of sprinting straight to the finish, you practice rising and falling on the arousal wave. Tools mean you use evidence-based supports, behavioral, physical, and sometimes pharmacologic, to make retraining easier and more consistent. Start with knowledge. Over the next week when you're alone, notice the stages of your arousal. Imagine a 1 to 10 scale. At 1 or 2, you're curious but not physically aroused. At 5 or 6, you're very engaged, breathing deeper, pelvic muscles subtly tightening. At 8 or 9, you feel the strong urge to climax. At 10, the reflex commits. There's no turning back. Your skill point lives at 7 or 8, the place where you sense, if I keep going exactly like this for another moment, I'll cross the line. If you can identify that edge, you can learn to pause, breathe, soften, and return. That moment is where you take the reins. Now, retraining. When early sex education talked about the start-stop method or the squeeze technique, it sometimes framed them like gimmicks. In reality, start-stop is a form of reflex conditioning. You bring yourself, or with a partner's help, toward the urge, pause before the point of no return, let the wave settle, and resume. You repeat that cycle several times deliberately. Each cycle teaches your nervous system that high arousal doesn't require immediate completion. The reflex threshold becomes less hair trigger. Traditional instructions often say stimulation for a minute, pause for 30 seconds, but I prefer body-based pacing rather than a stopwatch. Let your breathing guide you. When you pause, inhale slowly and exhale slowly 5 to 6 times, allowing the pelvic floor to release. You're not clamping down, you're letting go. Resume with lighter touch or slower rhythm and build again. Over sessions, the number of cycles you can do increases, and the intensity at which you can hover improves. Many people start to notice changes within a few weeks when they practice consistently, 2 to 4 times per week. The pelvic floor deserves its own spotlight. Those muscles support the pelvis, contribute to erection rigidity, and coordinate ejaculation. Many men with rapid ejaculation carry unconscious tension in those muscles. They're subtly squeezing throughout arousal, like driving with your foot pressing the gas and the brake at the same time. Learning to feel and release that baseline tension can make a dramatic difference. A simple practice is pelvic floor awareness breathing. While seated or lying down, bring attention to the area between the pubic bone and tailbone. On inhalation, imagine the pelvic floor softening and widening. On exhalation, release any residual squeeze in the buttocks, thighs, or lower belly. Do this for 5 minutes daily. If you notice a habit of clenching when anxious or when aroused, consciously soften. If you can access a pelvic floor physiotherapist who works with men, a few sessions can be transformative. They can assess overactivity and teach targeted relaxation and coordination exercises. Mindfulness is not a vague concept here. It's a very practical skill. When arousal builds, the mind often narrows to a tunnel. It's happening. It's happening. I can't stop it. That thought loop feeds the sympathetic surge, quickening the reflex. Mindfulness breaks the loop by widening attention, breath, contact points, whole body sensation, connection with your partner, so you're not trapped in catastrophic thinking. In practice, that looks like deliberately feeling your feet, your back, your hands, noticing the temperature of the room, the movement of your breath, and the sensation in your pelvis all at once. You stay inside the experience rather than trying to flee it mentally. Paradoxically, this presence reduces pressure. Reduced pressure slows the reflex. Communication with a partner changes everything. The most unhelpful frame is, I have to hide this and fix it silently. Hiding raises anxiety, and anxiety shortens the fuse. A simple, confident frame sounds like this. I want us to enjoy this without rushing. Sometimes my body wants to finish fast, so I'm going to pause and breathe when I need to. That way we can enjoy more together. That single sentence turns a feared problem into a shared pacing strategy. It also normalizes brief pauses as part of the rhythm. Many couples enjoy adding other forms of stimulation during those pauses, kissing, touch, positions that reduce intensity for a moment, so the experience stays connected and pleasurable for both people, even as you practice control. Let's talk tools, starting with topical anesthetics. Lidocaine prilocaine creams or sprays can reduce penile hypersensitivity for some men. Used appropriately, thin layer, applied ahead of time, wiped to avoid transferring to a partner, or used with a condom, they can lengthen time without numbing you entirely. Think of them as training wheels. They help you experience the arousal wave more slowly so you can learn the timing skills. Over time, some people rely on them less as the reflex reconditions. Condoms, especially thicker ones, can similarly reduce intensity. None of these are cures, they're supports to make behavior change easier. On the medication front, certain selective serotonin reuptake inhibitors, SSRIs, can delay ejaculation by altering serotonin signaling. Some are taken daily. Others, in some countries, are formulated for use a few hours before sexual activity. These are legitimate options, especially for lifelong premature ejaculation or when behavioral strategies alone aren't enough. The key is to work with a clinician who can help you consider benefits, side effects, and the right dosing strategy for you. If you also experience erectile difficulties, medications that improve erections can be part of the plan, because reducing worry about losing an erection can reduce the sense of racing to the finish. A word about porn and masturbation patterns. If your solo routine is intense, fast, and goal-oriented, your nervous system learns high stimulation, sprint, immediate climax. That learning can show up with a partner. For a month, consider reshaping your solo time into practice sessions. Reduce intensity, add pauses, and treat it as training rather than racing. If you tend to watch very stimulating content that escalates quickly, experiment with minimal or no visual media, and focus on body sensation, breath, and pacing. This isn't a moral critique of porn, it's a practical note about conditioning. Now let me give you a structured 4-week retraining plan you can start immediately. Week 1 is awareness and baseline. 2 to 3 times this week, have a solo session where your only objectives are mapping your arousal scale and practicing 1 or 2 pause cycles. When you reach about a 7 out of 10, pause completely. Place one hand on your lower belly and feel your breath move under your hand. On each exhale, imagine the pelvic floor softening toward the chair or bed. After 5 or 6 slow breaths, resume with a lighter touch. Repeat 2 to 3 cycles. Then let yourself climax without judgment. The goal is not how long you last, it's learning the edge and proving to your nervous system that you can step back from it. Week 2 adds pelvic floor work and breath training outside of sexual context. Every day, do 5 minutes of awareness breathing as described earlier. At the end of each breath practice, stand, bend your knees slightly, and gently shake your legs and hips for 30 seconds to release residual tension. In 3 solo sessions this week, practice 3 to 4 arousal cycles. If you're using a condom or a small amount of topical cream as a support, this is the week to try it. You're teaching your body a slower rhythm. If you have a partner, let them know you're practicing a wave style. If you're intimate this week, treat pauses as planned. Shift to kissing, touch, or positions that feel less intense, breathe, and resume. Keep the frame confident. This is pacing, not failure. Week 3 introduces attention broadening. During your pauses, instead of only focusing on the genitals or your breath, deliberately widen awareness to the whole body. Feel your feet, your back, your hands, the air on your skin, the sound in the room. Name a few sensations silently: warmth in my chest, cool air on my arms, steady breath, softness in the pelvis. This trains your nervous system to stay engaged without tipping over the edge. In solo sessions, continue 3 to 5 cycles. If you notice that after a pause, you can tolerate a slightly higher intensity before the urge returns, that's progress. With a partner, add a brief verbal cue for confidence. Pause, or even a shared breath count, 5 slow exhales together, then resume. Make this normal and even intimate. Many couples find these pauses become sensual anchors rather than interruptions. Week 4 consolidates and personalizes. At this stage, most people notice a clearer sense of control. You might not go from 1 minute to 20 overnight, but the subjective feeling, I can choose to pause and redirect, is the milestone that matters. Decide which supports you actually like. Perhaps a thicker condom for certain times. Perhaps none. Decide which breath pattern grounds you best. Some prefer a 4-second inhale and 6-second exhale. Others simply sigh and relax the jaw, which relaxes the pelvic floor by reflex. Decide which positions reduce intensity when you want a breather. You're building your own playbook. A question I hear often is, what if I still climax sooner than I want after all this? First, compassion. Patterns change with practice and with context. Tiredness, stress, alcohol, novelty, all of these shift arousal speed. A single night doesn't erase progress. Second, zoom out from a single moment to the whole experience. Sexual connection isn't graded by a stopwatch. If you pause earlier, reconnect, and continue with ease, that early climax may matter far less in the big picture. Third, broaden the definition of satisfying intimacy. Oral, manual, and whole-body touch, toys, and intentional sequencing, for example, focusing on your partner's pleasure first, can make the timing of ejaculation far less central. Ironically, when timing matters less, control often improves, pressure drops, the reflex slows. Let's speak briefly to the emotional layer. Shame is gasoline on this fire. Shame says, I'm broken, and the body hears danger, rushes, and releases. Swap shame for curiosity. Curiosity asks, what's the pattern? What helps? What didn't help? What can I try differently tonight? When you narrate progress to yourself, focus on controllable actions rather than outcomes. I paused twice and felt myself settle is a win even if the total duration was the same. Progress in neurobehavioral patterns is rarely linear. It's a trend with variability. Keep your eye on the trend. If you're in the acquired group, meaning this changed for you after a period of feeling fine, look for possible triggers. Did erectile confidence shift? Are you more stressed or sleeping less? Are you drinking more alcohol, using new medications, or recovering from an illness? Did you stop exercising and notice higher baseline anxiety? Small lifestyle changes can recalibrate your nervous system. Exercise improves serotonin tone and stress resilience. Sleep stabilizes hormones and attention. Reducing heavy drinking can improve arousal control. None of these is glamorous, but they matter, and the effects add up. What about supplements and over-the-counter solutions? You'll find many marketed online. Be cautious. Some products rely on mild numbing agents, others promise hormonal changes without evidence. If a supplement claims to cure premature ejaculation across the board, it's overpromising. The most reliable non-prescription supports are topical anesthetics with clear labeling and quality control. If you're considering any pill or powder, discuss it with a healthcare professional, especially if you take other medications or have medical conditions. If you have a long history of rapid ejaculation from your earliest experiences, lifelong type, recognize that your nervous system learned a fast track under the best of intentions. Many men learn to be sexual while hiding, rushing, or fearing discovery. That old urgency imprinted a reflex that stayed. The good news is that nervous systems remain plastic. With consistent, compassionate practice and, when appropriate, medical support, that imprint can be softened. I've seen men in their 20s and men in their 60s shift the pattern meaningfully. The common thread was not perfection. It was practice and patience. A note for partners who might be watching. Your presence can either add pressure or remove it. What helps most is a collaborative mindset, encouragement for pauses, appreciation for connection beyond a single metric, and curiosity about pacing that satisfies you both. Many partners tell me that once the conversation is open and the pressure is shared, the experience becomes more playful and more intimate, less like a test and more like a dance. That shift alone can change timing. Let's bring this together into a simple, repeatable session script you can adapt. Set the stage by deciding ahead of time that pauses are part of the plan. Begin slowly, letting arousal build. When you feel that clear upward pull, the onset of the urge, say pause, soften your jaw, exhale fully, and feel the pelvic floor release. During the pause, switch to touch or kissing that keeps connection but reduces genital intensity. After 5 or 6 slow breaths, resume with a rhythm or pressure that's one level lower than what brought you to the edge. Cycle this 2, 3, or 4 times. If you choose to climax, let it happen without judgment. If you want to continue afterward, take a longer reset, hydrate, cuddle, and return later with a gentler start. That's the whole method. It's simple to describe and profound when practiced regularly. If pain, burning, or urinary symptoms are present, or if there's a sudden change after prostate procedures or new medications, get evaluated. If anxiety, compulsive sexual behavior, or relationship distress are major drivers, adding therapy, especially approaches that integrate sexual health with anxiety skills, can accelerate progress. Collaborating with a clinician doesn't label you as ill. It gives you a coach and a tailored plan. I want to close with a reframe that many people find liberating. Control in sexuality isn't stoicism, it's responsiveness. It's not about muscling through sensation, it's about listening so closely to your body that you can guide the wave rather than being dragged by it. The moment you learn to recognize your true edge, the moment when you realize you can pause and the world doesn't end, that's the moment the reflex stops feeling like a trap and starts feeling like something you can play with. The science says your nervous system is changeable. The skills give you a path. The rest is practice and kindness toward yourself. If this video helped you understand your body in a new way, you can begin tonight with week 1. Map your arousal scale, practice 1 or 2 pauses, breathe into the pelvic floor, and end without judgment. In 7 days, you'll be able to feel the edge sooner. In 4 weeks, most people sense a shift. And as you keep going, the story you carry about yourself changes from "I'm broken" to "I'm learning." That shift, honestly, is the most powerful medicine we have. I'm Dr. Catherin Harris. Thank you for trusting me with something so personal. If you'd like a step-by-step printable of the 4-week plan or ideas for partner communication, let me know in the comments and I'll make it for you. Take care of yourself, pace the wave, and I'll see you in the next video.